Hi. Today I'm going to be talking about the effects of having or not having good hand hygiene and working in the hospital environment. Hand hygiene is very important in any type of environment, but it's most important in the hospital environment to me. Not having proper hand hygiene is the leading cause of illness in the hospital setting today. It's a way that patients can get communicable diseases or illnesses such as C. diff and infection. And what C. diff is it's a bacterium which affects and can make humans very ill. The symptoms usually range from chronic diarrhea to fatal inflammation of the colon. So if I were in the hospital, I sure wouldn't want to end up with C. diff because I had a nurse or a doctor that simply forgot to wash their hands when going from room to room, or simply forgot to use the alcohol-based hand rub before going from room to room, or didn't wear gloves. You have all three options before that disease could have been spread. So I did some research over what they've done about hand hygiene throughout the years, and I found quite a bit. I found that in 1961, the U.S. Public Health Service produced a training film that demonstrated hand washing techniques recommended for use by healthcare workers. And at the time, it was recommended that the personnel that worked at the hospital wash their hands with soap and water for 1 to 2 minutes before and after patient contact. And rinsing hands with an antiseptic agent was believed to be less effective than hand washing, and it was only recommended in emergencies or in areas where sinks were unavailable. And then in 1975 to 1985, formal written guidelines on hand washing practices in the hospitals were published by the CDC, and they recommended that hand washing with non-antimicrobial soap between the majority of patient contacts and washing with antimicrobial soap before and after performing invasive procedures um, at a high risk. The use of the waterless antiseptic agents like alcohol-based solutions was recommended only in times when sinks were not available, as it was in the 1961 time that I talked about a second ago. And then as we got closer to today, 1988 to 1995, the guidelines changed a little bit. The hand antisepsis were published by the Association for Professionals in Infection Control. Recommended indications for hand washing were similar to those listed in the CDC guidelines. And then in 1955, the APIC guideline included more detailed discussion of alcohol-based hand rubs and supported their use in the more clinical settings that had been recommended in earlier guidelines. At this time, the Healthcare Infection Control Practice Advisory Committee recommended that either antimicrobial soap or waterless antiseptic agent be used before cleaning hands upon leaving the room of patients anytime. When I was in orientation at the hospital, they told us this thing where we gel in and gel out. We go into the room and use the gel on the wall, and then we put on gloves, and then as we leave, we gel out too. So that's probably the guidelines that the hospital is going by from what I'm reading. Um, and also, while I was doing my orientation classes, towards the very end of it, we did this thing where we put on blue gloves, and then they put a little dot of red paint in our hand. And we were told to close our eyes and wash our hands as we usually would, just as regular, not how any way that we had learned, just normal. So we all did, and we all found out that we hadn't been washing our hands very well um, until we took that class. That we, just depending on the person and how they did it, didn't get in between the fingers or didn't get all the way up to the wrists or something like that. So that exercise really helped me out a lot in knowing that in order to wash your hands correctly, you have to get the whole entire hand. Um, that's just something that I found really interesting to ensure that the removal of all the bacteria before going into a patient's room. So I hope you enjoyed. Thank you.